Hello, friends. Today I will discuss about my next case discussion topic, that is when to retain, when to remove, or when to bypass your fracture instrument within the canal, the clinical decision making. Now, this is specially dedicated to those clinicians who loves to do a root canal treatment but doesn't use magnification. When you open the access cavity, you will see the bleeding is present within the pulp chamber. So these are considered as a vital tooth. Now, the advantage of vital tooth is are not heavily infected. So, root canal can be done in this condition also, that is in vital tooth or in non-vital tooth, where after the access opening, you will see no bleeding is present within the pulp chamber or within the canal. Is because due to the long-term exposure of the bacteria within the root canal system, in a heavily infected canal as like non-vital tooth, there is a role of intracanal medicament. In case of vital tooth, there is a main role is only and solely based on the irrigants. Now there are three important factors during your separation of the file within the root canal system. These are the location. It may be in the coronal third. The fracture can occur in the middle third or in the apical third. In next, the size of the instrument. It may be your smaller size of file. It may be your 10K file, 15K file, or it may be your larger size of file like F1, F2, or F3, or in case of fixed stepper 25 6%, 34%, whatever it is. Now the third most important factor is the cleaning and shaping status. Now separation can occur before major cleaning and shaping. Separation can occur after significant cleaning and shaping. Now, significant cleaning and shaping means in between instruments, at least you have cleaned the canal at least by a full syringe of high concentration sodium hypochlorite, and you shape the canal at least size 30. Now, separation can occur before that. Separation can occur after your cleaning and shaping at least done, and canal is already enlarged at least 25 or 30 size. So based on that, you have to make a decision based on the location, based on the size of the file, based on the cleaning and shaping status. Now let's start one by one. In case of vital tooth, if the separation is present in the coronal third, like on the left side radiograph, you should have to retrieve the separated fragment from the canal. Whatever, you don't use a magnification loops or microscope, you have to retrieve the file separated fragment from the canal. In case of middle third, try to bypass. If not possible, at least immediately obturate the canal, seal it up, and wait for the follow up. In case of future symptoms, consider root surgery. Now, in case of apical third fracture, like in this radiograph, you see there is an instrument fracture in the apical third. In case of vital tooth, the treatment is same like your middle third part, that is, try to bypass. If it is not possible, it is not going, and then you have to thought for a obturation coronal to the separated fragment present in the apical third, and immediate coronal seal is very important in case of vital tooth. Obviously, before sealing and before obturating coronal to the fracture fragment, if bypass is not possible, you do a profuse and significant cleaning, that is the irrigation, before you complete sealing the root canals. Now, in case of non-vital tooth, first let's divide into two categories. First is if significant cleaning and shaping already done. And next division is if significant cleaning and shaping is not done. Significant cleaning and shaping means, as I said before, between the each instrument, you at least clean the canal with a full syringe of high concentration of sodium hypochlorite at least, and you have to shape the canal at least size 30. So if insignificant cleaning and shaping is there, and during the period you fracture a file within the canal, so in case of coronal third, it is the same as like your vital tooth, that is you have to remove the fracture fragment from the canal. In case of middle third, you have to try for a bypass. If it is not possible, obturate coronal to it, do a immediate seal, wait for the follow-up. If become symptomatic, consider alternative, that is root and surgery. In case of apical third, it is also the same. Try for the bypass. If it is not possible, obturate coronal to the fracture fragment after a significant irrigation, do a coronal seal, and then wait for the follow-up. And if in the after the follow-up, if there is any kind of symptoms, consider the root and surgery as an alternative. But if the cleaning and shaping is not significant and before that you fracture a file within the canal, then what happens? In case of coronal third, the treatment will be same. You have to remove it by any way, otherwise the prognosis will be very poor. In case of middle third, try for a bypass. If not possible, at then consider calcium hydroxide intracanal medicament therapy for 2 to 4 weeks. If asymptomatic during this period, then you complete the obturation, do a immediate post endofailing, wait for the follow-up. In case of apical third, try for a bypass again. But it is if it is not possible, give a calcium hydroxide therapy or any other intracanal medicament therapy for 2 to 4 weeks. Wait for this period, see the symptoms of the patient. If become asymptomatic, obturate it, finish it off, do an immediate post-op, wait and watch. In case of future symptom, consider root and surgery. See, in clinical scenario, if you don't have any kind of magnification, the best possible way, what I feel, is bypass. If it is not possible, then you have to obturate coronal to the fracture fragment. And next main thing what I want to say is frequently check your instrument before use for any kind of unwinding. In case of hand files especially, restrict the number of files rotary you use in the patient mouth. At least you have to know the number you are using in the patient mouth. And third is do a proper irrigation between starting of the first file. So this is all about my short presentation, and thanks for watching my video. Please like, comment and subscribe for more videos like this, and we will meet in the next video very soon. Thank you.